Hello, my name's Mark.
Hi, I'm Brian, and welcome to the Therapy Shed podcast.
Hello.
Yeah, Mark. How's things?
All right.
Yeah,
I'm good, thank you. How's your good self?
yeah, not too bad. Looking forward to doing another episode, and I think today's episode is
Another round of our podcast. Yeah, today's episode is titled Breaking Down the World of Therapy.
I think
Took me a while to think of that one. I'm quite
Yeah.
proud of that title.
comes to mind. Are we breaking it down with a sledgehammer or
Yeah, definitely.
or picking it apart?
Yes, picking it apart with a nice polite pickaxe.
Yeah.
But yeah, breaking down the world of therapy. So this episode's going to be a conversation around, of course, the world of therapy, but the kind of different types of therapies that are out there now. Some of the, I guess, we're going to focus for today, I think, on more of the more prominent ones, like the ones that are most available. But I think there can be, you and I have had many discussions, haven't we, Bri, about the myths and the myths and misunderstandings, maybe, both that we've experienced, I'm sure, during our training and from the outside looking in, maybe, but also that can be there in kind of the public consciousness as well around therapy and what it involves and what different types of therapy relate to, what they're suitable for, what they tend to involve. Maybe, hopefully, we can give a bit of a taste of what to expect if you're accessing that particular, form of therapy.
Yeah, definitely. And I think one of the things why we sort of spoke about doing this episode was because when people are looking to access therapy and or being advised to go to therapy, it's knowing what to access, because there's that many different things people are told and or not told. And I think sometimes, and I know we're going to cover all of this as we go along, but the most common, probably I'd imagine, type of therapy is CBT. And CBT is great, which we're going to touch on that, but it's not for everybody, and it's not for every single thing that somebody might be going through. But the amount of times people come to me, for example, and probably the same to yourself, and say, "Oh, I need CBT," and because that's all they know of. So then when you start speaking and understanding what it is that they need, it's not CBT, it's another type of counselling. But because people aren't aware that there is different types of counselling, people automatically think CBT is the only one, for example. So I think that's why it was, for me, quite useful to do this episode where we can talk about a couple of the different types of therapy and counselling. Obviously, we're not going to be able to touch on all of them today because there's a lot. But I think we are going to look at some of the more sort of main ones, aren't we? And sort of just briefly go into a little bit of detail about what they mean, what they are, what they're not. And then maybe we will have to do a future episode where we actually go into them a lot more deeper, where, CBT, and spend the whole episode on what is CBT, what does it look like, how does it work, person-centred counselling and the other different types of counselling. But I also think you're right. I think a good starting point for today would be having a little look at some of the myths around therapy and counselling, and what it is and what it isn't.
Definitely. Yeah, I completely agree. And it's interesting because one of the motivations for myself of doing today's podcast is really, hopefully, to just offer a bit of an insight to maybe any of the listeners who haven't engaged in therapy before, or as I say, like we all have, it's in different stages and different things in our life. I've got an outsider's perspective, shall we say, because the motivation for me in doing that is the sense of you actually have an idea of what works best for you, because you know yourself better than anyone else does. So if you're being told that CBT is suitable for you, I think it can be helpful to go, well, I have an idea of what that is, you know what I mean, and what it can involve. because I think it can happen. I mean, well, I don't think, I know that it happens. It happens in the industry as well. You know, it happens in the healthcare profession that people are referred between different services or different departments for CBT, for example, or a particular therapeutic modality, and it's when it's unpicked and unpacked, shall we say, what's actually going on for that person. It's not necessarily the most suitable approach. Do you know what I mean? But it's just, as you say, that sense of, well, that's an overall therapy that, you know, most people get a lot out of counselling, so go for counselling, you can have a chat with someone. Whereas if the person hopefully has got a little bit more of an understanding of what counselling is or what CBT is, they can have a bit more autonomy, you know, feel a bit more empowered to say, no, I definitely don't feel that that's what that's what's going to work for me at this point in my life.
Definitely. And I mean, I think the other thing to bear in mind is, you know, sometimes people do come for therapy and they're not sure about the different types of therapy. They just know that they need to come and speak to somebody and get some sort of professional help. So it's then down to the therapist to be able to talk to the client about, you know, the different types of therapy that they can offer, or listen to what the clients bring and what the issue is, and for them to be able to help them make a decision about whether they're the right person for them, because the type of therapy they offer might not be best suited to that person.
So yeah, definitely. I think, and just to kind of reify what you're saying there, Brian, I think a really, you know, a well delivered and ethical assessment session should definitely involve that. You know, it's empowering the client, isn't it? You know, what is going on for you, and obviously what is it you're looking to, and what you're expecting, and what are you looking to, you know, to get from therapy. You know, what's the client's perspective. So as we're saying, this is a very brief overview of some of the key therapeutic approaches. So one of the ones, of course, you know, what better place to start than counselling and person-centred counselling. So if someone asked you what's person-centred counselling, what would you be likely to say?
Well, I think just before I say that, I think person-centred is a really good place to start, because that's probably, for me, almost the original therapy and the original counselling. That's where it was founded, almost, wasn't it? I know there was things going on before that, but I think person-centred, which was developed mainly by a guy called Carl Rogers in about the 50s, I think, wasn't it?
Yeah.
You know, there was obviously therapy, I think, before that, but that was when it really got a sort of strong hold and got sort of quite cemented that actually people going to therapy, it can be really helpful. And then as a result of person-centred counselling, lots of other therapies have then been developed as a result of that. But for me, all therapy and counselling sort of stems from person-centred. Would you agree?
I would agree, yeah, definitely. I think it's you could put quite a conclusive argument together to say modern day talking therapies, whatever in whatever configuration, you know, whether it's CBT, DBT, you know, the list goes on and on in you know, today's world. Modern day talking therapies are the foundation of them, or the base of them all is, you could put a good argument together to say is Carl Rogers person-centred counselling, you know, humanistic therapy.
Yeah, definitely. So I think, going back to the question of what would I say if somebody asked me what person-centred counselling was, I think the philosophy of person-centred counselling is that people are essentially good, and that ultimately the individual knows what is right for them, and that's essential. That's the essential ingredient for a successful person-centred therapy session to take place. That essentially people are good, and people are the best experts on themselves. They know, although it might not be clear to them, but ultimately they know what they need and what's best for them to help them deal with whatever issue it is that they may feel that they have. And with the right conditions, which was part of Roger's theory about core conditions, which is a set of conditions that are in place within the therapy room that allows the client to feel safe, to feel listened to, and to feel understood and to feel heard, that they will eventually, by talking to the therapist, will be able to come to their own conclusion of what's needed for them or what's best for them to be able to move forward. And that's done by, again, sort of without trying to get too much into the theory, but things like self-actualization, becoming a fully functional person, and self-worth as well. I think within person-centered, it's a lot about sort of self-worth. So I think that's how I'd answer the question. I don't know if you'd add any more.
Sold. You've got me. Yeah, no, I think that was a very. I completely agree with your synopsis of person-centered counselling there, Brian. It's interesting as well because all the things you name in there about Rogers, the conditions that are required for therapy to take place, or when we say about that being the bedrock of modern day talking therapies, I think that's exactly what we're referring to, isn't it? All those things are required, and just to elaborate a bit further on that, Rogers' core conditions, as he labelled them, the core conditions of counselling, of therapy, are, let me make sure I'm getting these right: unconditional positive regard, check, congruence, and empathy. I haven't read on that one for a while,
they're the three main ones. But there's actually 6, isn't there? But they're the 3.
Yeah, absolutely. Yeah.
But I won't challenge you on the other 3. I'll let you off with that one.
We haven't got time for that. Never mind about that. But and I think that is, for me, it was just interesting when you were talking then about the core conditions. That was the first thing that comes to mind. That's what I think we mean when we're saying that's the bedrock of modern day talking therapies, is for useful, effective therapy, shall we say, to take place. They absolutely need to be, alive and present in the therapy room.
I think so. I think the only slight difference with person-centered therapy compared to other therapies, for me, they definitely all have to be there. But within person-centered counselling, it's essential that they're there. The theory is that the therapy won't work unless they are there. If those conditions aren't there, then that particular therapy sort of won't be successful. Where within the likes of, say, CBT, for example, for me, it's really important that they're there, and I think it definitely, if that relationship is established and it's well, then you're going to get more positive results. But it's not the essential ingredient for CBT to be successful. It's a very important ingredient, but it's not the most essential. I would say, where in person-centered, it's the most essential.
Yeah, I agree. Yeah, and I think that's person-centered counselling training. That's exactly what you would be taught. That's the central to the theory and into person-centered model is exactly what you're saying there. Yeah, they are front and centre of every session. Are those core conditions? Yeah, it's fascinating, isn't it? With with Rogerian theory, with the more I read and continue to do today, Carl Rogers is not just, I suppose, his teaching as a clinician, because he was a researcher, wasn't he? He was kind of the bits and pieces I've read about him as a person. He was kind of caught up in the 60s, kind of to put slightly, I don't know, maybe a tarnished label on it, like the hippie movement in the 60s, a very spiritualized time, and he was kind of very much invested in that as a person, and I think that's where person-centered therapy came from, this idea that we shouldn't be thinking of human beings as broken, we shouldn't be thinking of human beings as bad and need to be trained to be good. It's as you were describing, that's, I guess, it makes sense that person-centered therapy is very much human beings are good and are experiencing challenging or tough, or if you want to say bad situations, and are adapting to that or trying to respond to that. But if in trying to offer support, whether it's in everyday life or as a therapist, you're treating them as though they're insufficient or they're lacking the skills to do it, you're going the completely wrong way about it as far as Carl Rogers is concerned.
Yeah, definitely. And I suppose like an analogy to compare it to is if you went into hospital with a broken leg, you would me and you would be treated exactly the same in the sense of, you know, we both had a broken leg, so we'd go through the stages and have physio, and the physio would be very similar. Where with person-centered counselling, when a person comes into the room and sits down, you know, that relationship and that way of working could be completely different from the next person who comes into the room in a person-centered way. So as though it's both person-centered counselling that would you be offering, but the way it's delivered is very individual to that person, because it's about that person. It's not about anything else. When that person is in that room with the therapist, it is about that person and that person only.
I think that absolutely, yeah, and I think that's a really important point to make, Bride. That sense of I suppose it's, you know, you could say sadly in many ways we live in a society, and personally I don't think this is so much a new thing. I don't think this is specific to, you know, today's society, but in everyday life we don't have kind of 100% empathy and unconditional positive regard and non-judgmental attitude towards other people, even people who we love, you know, with our whole soul, you know, people who we see as close as can possibly be, as two people can possibly be. Those Rogerian conditions that we're talking about, I think if we're honest, they're not usually there, are they? Or they're certainly not there continuously. Whereas therapy is that sense of you're meeting somebody on their terms. And I guess, and we can maybe come on to this, the idea of the difference between speaking with somebody who you're really close with, maybe it's a friend or a family member, and actually speaking with, with a counsellor in a person-centred way.
Yeah, and I think it's because in the therapy room, when you're working in a person-centred way, the idea is to step into that person's world. It's being sort of almost 100% immersed into their world and understanding the world from their point of view, while also being objective about maybe what's going on for that person. Where I think when we're outside the therapy room and with friends, family, people we love, we often see it from our own point of view, and we're in our world. As you know, we can't fully step into their world because obviously there's emotion involved, there's lots of feelings involved, and you know, again, the world is going on. We've got our own worries, our own stresses, our own sort of life. Where within the therapy room, as a therapist, that has to stay outside. That can't come into the room, and that's the idea of the training that you do. That you understand that when you're in that room with that person, that you step into their world.
Yeah, absolutely. And I think that's where the core condition of congruence, which is just vital. It's arguably the most important thing, isn't it? As for everything you're saying there, Brian, being congruent with somebody in their world and understanding things from their perspective. And as you touched on this before, but I think Rogers said, only when we can truly accept ourselves for who we are do we then have the ability to change. Where don't quote me on that.
Pretty close.
Was that pretty close? Yeah. Okay, I'll take that one. But yeah, and I remember reading that reading the quote where it's the effect of that. When I first started training as a counsellor, and I was blown away. That was like wow, that's good. I like that. You know, it really. And I think again, that's just crucial to everything we're talking about. So that sense of you're empowering the client, not by telling them you think they're fantastic, because again, that would be a judgment. That's your perception on them. You are empowering them by immersing yourself 100% into the way they're seeing things, the way they're experiencing things. You know, you're not bringing your vested interests or your personal opinions into the room. That's not, that's not ethical as a counsellor. That's not person-centred counselling.
Yeah, I mean, and it's not about within person-centred. counselling, it's not about giving advice. It's not about telling the person what's best for them. It's not about telling the person what they need to go and do. All of that is for that person to be able to come up with their own solution for themselves. But what the therapist does and the counsellor does is, helps them. They act as a guide, I suppose, a guide through those feelings and emotions to help them understand how they're feeling and what they're experiencing, to then come to the conclusion of what they then need to do about that.
Yeah, definitely. And it's, I mean, as we've said, we could talk about, Carl Rogers and the key concepts of person-centered counselling for hours on end. We really could. But something that's just come to my mind then that, again, just really, when something you learn something, or you read something, it doesn't necessarily have to be specific to, obviously, therapy training, just in your life as a human, as a person, you learn something and you just kind of feels like it stops you. Do you know what I mean? You just feel like, wow, where's that been all my life? Or, that can't kind of really stops you in your tracks. Or you just take a second and like stare at the wall and think, God, that's good.
Yeah.
That's my way of, I guess, articulating that thought. But I think most people will know that feeling. I hope most people know that feeling anyway. And with Rogers, something that's just come to my mind then is the locus of evaluation.
Mm-hmm.
That whole concept of the locus of evaluation. And I just wondered if, just to share that really, what is the locus of evaluation and the importance of that, I guess, when just learning that as a concept. Why could that be valuable to a client in therapy?
So I think a locus of evaluation, sort of a very quick explanation of it is the theory is that we have a internal locus of evaluation and an external locus of evaluation. And basically what that means is, if we are, as a person, needing to make a decision about something, if we trust our own locus of evaluation, we are confident and happy to make that decision, and we will make it without worrying about if it's the right or wrong decision. And even if it's the wrong decision, it doesn't matter. We have the confidence within ourselves to make them decisions. Where if we look for an external locus of evaluation, it's seeking that reassurance from others. So I need to make a decision about myself that's based on myself, but I don't have the confidence within me to be able to do that, so I have to go and seek that from other people. The problem with that is sometimes what that other person might feel is best for you might not be best for you. And then they make a decision, they tell you what they think's the right decision, so then you take that on board, you go and make that decision, and it's the wrong decision, or it doesn't work out, then that can cause more emotional distress. So it's about working on becoming more trusted in your own feelings around making the right decisions and your own opinions, and a lot of that then stems into self-actualization, trusting your own judgment, your own feelings, being confident enough to trust how you feel.
And I think the key thing with, which you've just been, described, Brian, the key thing with locus of evaluation as well is, if somebody is telling you what to do, whether you feel like, well, a therapist can tell me what to do, which, I'm sure we've both had that experience. We're both clinicians. We've both had the experience of a client wanting us to, well, what do you think? What do you think I should do? And of course, any ethical practitioner will, I'm sure, would say, that's not your job. And it's actually very unethical to just start telling the client what they should and shouldn't be doing. That's not what therapy is at all. But obviously, as you say, in everyday life, that can sometimes be well, I'll ask that person. And although that can be helpful, there's actually an awful lot of research that shows that it can lead to a more depleted self-esteem. It can lead to a significant decrease in your self-esteem, because of course, if somebody else is telling you what to do, if it goes well, maybe consciously, but certainly subconsciously, you interpret that as, that's great, that was because, Uncle Frank told me what to do, so I'll go back to him next time I need some advice. You're not actually empowering yourself at all. You're not developing your own, your own self-worth and your own sense of self. Equally, if you ask Uncle Frank what to do and it doesn't go so well, you blame Uncle Frank. So you're also not empowering yourself. You're not, you're not evolving as as you said before, as like as a person, as a fully functioning person. So your self-esteem can become ever more fragile if you've got that sense of a real external locus of evaluation. You're always dependent on other people for their judgment as to what you should be doing with your time. So I think that's a crucial thing in counselling as well.
Yeah, definitely. And I think, asking someone for some advice about whether you might be thinking of buying a new car, for example, and you're a little bit unsure what model to get, so you ask someone for some advice because you don't know a lot about cars, and they give you some advice. That's fine. That's pretty normal, isn't it? But if you were making a decision that was maybe more around, let's just say, for an example, a relationship, whether to stay in a relationship or not to stay in a relationship, but you don't feel you can make that decision yourself because you don't trust your locus of evaluation, so you then have to go and speak to somebody else to see whether you should leave a relationship or not. That's
Definitely.
not really healthy. If a person should get to a point where they trust their own judgments about what they need to do in that type of situation.
Absolutely, yeah. I mean, on the car analogy that you used there, buying a car, I think in some respects, I was listening to you speaking there, Brian, I was thinking it'd be with the sense of locus of evaluation. Yeah, it makes perfect sense to say to Uncle Frank, he knows about cars and he understands them far better than I do. I'll ask him because he knows the score with cars. That can be makes sense. That could be really useful and a constructive thing. But if you then say to Uncle Frank, how do you think I should feel when I'm driving this car? That's where your locus of evaluation can be really skewed.
Yeah.
I think that's, not stretching that analogy too much to say that's where Rogers would say your locus of evaluation is always on that continuum between an internal and an external. But I think Rogers said that if it's imbalanced one way or the other, whether it's extremely internal or of course extremely external, that's when it can be unhealthy.
Yeah.
For yourself as a person.
Yeah, definitely.
Yeah.
And you can just be, we can, with person-centered counselling, as you say, there's lots of theory that backs up, the actual practice of it, and we could speak about it all day. And I think, like we said at the beginning, it may be helpful to have an episode that's specifically around person-centered counselling. I know we're probably going to touch on CBT now as well, and again, what we will talk about today will only be a bit of a
snapshot, really,
an
overview,
overview, the same way as what we're doing here with person-centered.
Definitely. I mean, these are obviously, as we've mentioned, these are therapeutic modalities that are delivered worldwide now. They're two of the most, person-centered counselling and CBT, which we'll come on to now, are two of the most accessible therapies in across the world today. So we could talk, you and I particularly. We don't need a big subject to get a lot of long conversation going, do we, Brian?
Definitely not.
But yeah, we could. So we will definitely do future episodes, maybe in a bit more in depth of whether it's person-centered or key areas of person-centered, and of course CBT as well. But just before we move on to CBT, what would you say, if I can ask you, Brian, what would you say is suitable for counselling as a person? What sorts of problems or issues may I be struggling with where counselling could be a useful therapy to access?
So certainly things like bereavement is one that I would say person-centered can really work well with. Bereavement or any type of loss, as in maybe a relationship breakup or another type of loss, even sometimes even like a job, for example. one, anything that sort of is a normal emotion that people go through. So, you know, for example, bereavement, CBT wouldn't necessarily work well with bereavement because you can't necessarily change the way you think if you've had a bereavement, because a bereavement is sad. It generates a lot of emotion, and it's a lot of normal emotions to feel sad, obviously, if you suffer a bereavement. But what can sometimes happen is, after a period of so many months, a person still really struggling with them feelings and emotions around that bereavement, coming to counselling to talk about that and, you know, look at that will help them understand what they need to do to sort of help them, I don't want to say move on from that, but help them understand why they're feeling the way they're feeling.
Definitely, yeah, I agree, and like help them and offer that again, to come back to that active listening in counselling. You know, that environment where they have 100%, you know, focus and time for themselves, for their actual selves, you know, and their emotional self, of course. I think is just can be, you know, can mean everything, and can be really really powerful for a person who's going through something like bereavement. And as we said, you know, active listening. I think that sense of not just feeling like you're in a conversation, you're just having a chat, even with somebody you're really close to. Of course, that would help. And activating support networks is a crucial part of, you know, self-care and of therapy, really, as well. But it's not just having a chat, I guess, as we're saying, with therapy and with counselling. It's about the active listening, that you're not judging the person and you're not so much colluding with them in some ways. You're actively listening to them and accepting their world and their perspective on things. So yeah, I completely agree. That's bereavement, I think, can be extremely powerful for being able to go through that process of loss.
Yeah, definitely. But yeah, and even things, you know, sometimes when people just feel they've lost themselves a little bit, they're not sure what's going on for them. They just feel a little bit lost within themselves. Coming and having person-centred counselling, where they can just sit down and talk about how they're feeling or what's going on for them, and in a way, like we've said about with all the conditions, not feeling judged, being able to just speak openly and talk about whatever it is that comes up for them. Because eventually at the end of that, hopefully by doing that and it done in the right way, that they will then start to gain an understanding of themselves and who they are. Maybe that they felt that they lost maybe a little bit.
Yeah, definitely. It's interesting you say that, because it reminds me of some stats I saw over, I think it's over the last decade or something. I should look this up, really, but I think it's over the last decade, year on year, one of, if not the most Googled question, shall we say, the most Googled thing is, who am I? Or how do I find out who I am as a person? Questions that essentially relate back to personal identity, learning about yourself as a person. And I just think that's a really relevant thing, if you like, relevant stat for person-centered counselling. Is it can be a really powerful experience, a really powerful environment and relationship for actually learning about ourselves. You know, identity is a crucial part of us being able to, as you said before, have that self-actualization. You know, that sense of being, to use a slightly cliche turn of phrase, to be the best version of ourselves, is actually understanding ourselves. You know,
definitely. And I think, you know, although it might sound like a bit of a cliche, but I do think it is about being able to offer the best version of ourselves. Definitely. Yeah. I think, you know, if we can offer the best version ourselves to ourselves, then that's only going to make us feel empowered. It's going to make us feel, you know, worthy. It's going to ultimately allow us to be there for other people.
Yeah, sold again. So we were talking about CBT. Now, as we said before, CBT is probably, I think I would, my hunch would be, it's the most widely known, or certainly widely heard about therapy in the UK today, maybe worldwide today. So for those who may not be aware, CBT stands for Cognitive Behavioural Therapy, and it really exploded in terms of an accessible therapy initially in the 1990s, and then in the 2000s with the NHS rolling out the IAPT model, the improving access to psychological therapies. I think CBT was kind of front and centre of that, that offer of therapeutic support. So, as I say, cognitive behavioural therapy. So CBT, again, this is a brief overview. CBT looks to have a look at our thoughts and our behaviours, how we interpret situations, how we make sense of a situation or a particular experience that we've had that we may have found challenging or problematic. And it looks at things like what are known as cognitive distortions, so how we may be interpreting a situation based on our purely subjective view and leading to negative assumptions or very self-critical assumptions about ourselves. A key component of CBT is it's goal-orientated. So almost always in CBT, from the in the early sessions during the assessment, usually you'll work with your therapist to identify the goal. What is it you're looking to get out of therapy? So my personal way of kind of talking that through with a client is I always say, what's the overall therapy goal? So we can have mini goals along the way and, targets and stepping stones, but what is it, if therapy goes well, what you're looking to achieve out of therapy? So I think straight away that's where it differs a little bit from person-centred counselling, because it is very much you identify a postcode and you look towards you find a way that works best for the client to to navigate towards that. It involves a bit of homework. I try and avoid that word, if I'm honest with you, Bri.
I do.
Always has negative connotations when you say homework. That's when you go, oh, I'm not doing that.
I use tasks. I normally say, right, so the task for this week.
Me too. Yeah.
Yeah, because even homework for me, it brings back memories of school, and I hated homework. So for me to try and say to somebody, I've got some homework for you, just doesn't sit well with me. And sometimes, again, and that's more about me than the client. But I use tasks. The task for this week is...
Yeah, definitely. Weekly tasks. So it does involve that. So it involves either, I guess, some of the main examples of tasks would be like behavioural experiments, or we'll look at like worksheets on cognitive appropriation. So we'll look at how you've what beliefs have you got, what other ways are there of looking at that. So for example, if someone maybe thinks, I always get shouted at in work, it could be a negative belief, negative self-belief that I'm rubbish at jobs, or I'm rubbish at my job. So of course you could look at challenging that belief and saying, right, okay, well, what happened? Let's look at, are there any other ways that we could understand that? Are there any other factors that we might not be taking into account when we're coming to that self-judgment of I'm rubbish at my job? And you could look at maybe an alternative perception. Could be, well, I'm struggling with certain areas of my job, but I'm trying to improve, and I'm actually getting really good feedback in other areas, or other people are struggling as well at the moment, so it doesn't define me as a person. So that's just an example off the top of my head of how...
Or my manager that just likes to shout.
Exactly, yeah. Or I don't like my job. It was a nice way of saying I'm not rubbish at my job, I just don't like it. Yeah, exactly. So we look at, in CBT, that's very CBT centric. You look at how you're conceptualizing and the perceptions you have on your experiences. Are we taking in all of the the situation into account before we come up with these maybe self-judgments, either about ourselves or of course about other people as well.
And I also like the idea within CBT that we can really get to challenge those thoughts, those negative thoughts as well, and that can be quite useful within CBT. I find actually challenging those negative thoughts, because a lot of the time a person will have a thought, and because they've had that thought, they'll just run with it. I always describe it to clients as like we run those disaster movies or those horror movies in our head. So we have a thought, and because we've had that thought, we automatically think it's real, or we believe that it's real.
Definitely, yeah.
But actually, when we challenge it, and when I say we challenge it, I'm talking like when the client starts to challenge those thoughts themselves, that's when actually they can start realising that a thought is just a thought. Just because we have a thought doesn't mean it's real or it's true. And that's where I find CBT really helpful for people. Once people start understanding that just because we have a thought, it doesn't automatically mean that it's true.
Yeah, absolutely, I agree. And that's very, you know, the way I work in CBT, and I guess that's the way CBT practitioners should work. That's the way the training is centered around the idea that you are not your thoughts.
Mm-hmm.
You know, we have thousands of thoughts consciously and certainly in our subconscious mind every day, thousands of thoughts every day. And for maybe a number of reasons that maybe we're aware of in the moment, maybe we're not aware of, and therapy can help with that. For whatever reason, or the number of reasons, we've given a lot of importance and a lot of meaning to this particular thought, or these particular negative thoughts, or thoughts of very self-judgment.
I think it's the thought. Obviously, when we have a thought, if it feeds into our negative beliefs about ourselves, then that's what gives it the energy or the fire, doesn't it, for us to latch onto that thought. Where if we have a thought that doesn't affect the beliefs that we have about ourselves, then it's quite easy to let it go. But if it feeds into what those beliefs that we already have, that's when it becomes more sort of emotionally distressing.
Yeah, definitely, I completely agree, and it reinforces, negative beliefs, doesn't it? And I guess if our self-esteem is quite fragile, or maybe, we're struggling for confidence, whatever it may be, or again, to come back to the person-centered understanding, struggling for self-identity, having, negative automatic thoughts or real negative self-beliefs, it can reify that a fragile self-esteem. It can reify internal beliefs of I'm not good enough, or everyone just gets on with things and I can't, or those real sort of quite vicious judgments about ourselves. And if we have negative thoughts, as you say, and Brian, I agree, that can reinforce that. And unfortunately, it can become a really, it can lead to, of course, things such as depression and severe depression or severe anxiety. It can really lead to a lot of pain. So that's the intention, and the hope is that that's where therapy can be of real value to a person who may be experiencing that.
Yeah, definitely. I think you asked me at the beginning around sort of how would I almost define person-centered counselling, and I think I use like the philosophy of person-centered counselling. I think with CBT, if you were to ask me that same question, I'd probably say, CBT helps to recognise negative thoughts, to break the habit of those thoughts, and to find a more positive way of thinking. And CBT is really good for that. I think with and again, I'm aware that I don't want to start getting into mentioning certain sort of theories around it, because trying to then explain them will take too much time. And like I said, maybe us doing an episode specifically on CBT would be good to do.
Yeah,
that.
definitely. I'm sure we will. Yeah.
But just things like a really simple CBT type technique would be, when people have really negative thoughts that maybe then cause anxiety, is looking at things like, just that back to that challenging of, okay, well, what's the worst case scenario? What's the best case scenario? What's the most likely scenario? When you actually start doing those types of exercises where you are using your more logical thinking and the challenging, and actually sitting down and thinking about it rather than just letting that thought run away, that's when it actually starts becoming really helpful. That's when you can actually start change the way you think about certain things and certain situations.
Yeah, definitely. And I think it's, as you say, and that's hopefully where therapy can be useful, can be really, really useful. It's giving somebody an opportunity to do that self-reflection, and to question their thoughts, as you say, and look to see, well, what type of person does the evidence suggest I am? You know, when I actually try and look at it as objectively as I can, and do that self-reflection. And also, what type of person do I actually want to be? You know, and finding, I guess, somewhere, you know, you look to find that middle ground where you're like, what type of person do I want to be? What type of person does, you know, do I realistically feel like I can be? And doing that, I think that a lot of that can just be so valuable in therapy sessions, because again, it's empowering for the individual, isn't it?
Definitely. And I think the thing with being empowering, which is really good, and what I really like about CBT, and it can be used in person-centred, but more CBT, is the psychosocial education around, you know, helping the person understand what thought processes are, what automatic negative thoughts are, how our brain works chemically, in regards to sort of anxiety and, you know, for thoughts, feelings and behaviours, where in CBT we teach that to the client, so the client understands, oh, okay, so the reason why I'm thinking these things is because my brain works in this particular way, which is the same as everybody else's brain. You know, I know we all think differently, but our brain function all works the same. So I really like the CBT element of that, as I say, the psychosocial education of actually teaching people to understand why they are feeling or thinking or acting in a particular way. I think that's another really good positive to CBT for me.
Yeah. Oh, yeah. Crucial. Absolutely crucial. I couldn't agree more. It's interesting you kind of highlight that as well, Brian, because the amount of times I've had conversations with clients, and sometimes I can feel like I become a little bit self-conscious, thinking I'm not teaching them psychology, you know, so I'm mindful not to. And I might share that with the clients. I've done that on a number of occasions where you say, you know, I don't want to go off on a tangent, or is this helpful, me sharing this with you? And every single time, without fail, I think that is really empowering, and really always, every client without fail that I've worked with has said that they find so much value and use in just having a bit of a baseline understanding of psychoeducation, as you say, just how the mind works, and some basic techniques that we can use to just stimulate and, you know, affect the mind in a positive way. And that's, very much, again, that's very much in the world of CBT. It's looking at what can I do to positively impact my mood and my, you know, the way I think. So the psychoeducation element is massive. I mean, with it's room one of the therapeutic process with CBT is actually having those conversations around, you know, you're not telling the client about them in their personal self. You're talking about it almost in a scientific sense, aren't you? You know, yeah.
I mean, I have obviously listeners can't see it, but I have a model of a brain that often when people are talking about anxiety, I will get the model out and show them the inside of the brain, and it's got all the different elements to the brain, and so to just, you know, explain how it works and where the anxiety comes from, and, you know, the difference between sort of the amygdala and your frontal lobe, and sort of just, you know, and it sounds sort of quite technical, but, you know, what, as you say, it's not, you know, teaching them, it's not spending hours and hours and hours talking about it, it's just giving a brief overview and a bit of an education around how our brains work in a very simplistic way, because I only know it in quite a simplistic way, but it's enough for that person to go, oh, okay, so that is normal, I am normal, the way I think and feel is normal.
Definitely, yeah, I agree, and it's, no, it completely resonates what you're saying, you know, working with clients. And myself, when I first started learning that, you know, a good few years ago now, but when I started learning about psychobiology and, you know, I guess cognitive psychology as well, that sense of just that psychoeducation, those fundamental understandings, they can completely change your self-perception. They really can, you know. And I almost feel like it's just, when we feel vulnerable, we often feel again, as you say, without going off on a tangent too much in this episode, it can be what the emotional brain, like controlled by the areas of the brain that are in charge of our kind of primary emotions. And when we feel vulnerable, we understandably can go into defense mode, because the mind feels like, well, I need to protect myself, I need to survive. So physiologically and psychologically, we can go into that kind of survival mode. If that's being driven by anxiety or, a lot of self-criticism, it can actually not be necessary, and it's often not. If someone's in therapy, they'll say, yeah, and I know looking back, I didn't need to be that worried or that panicked or that kind of scared or whatever it may be, but it just felt so horrible and so powerful in the moment. And I think just understanding that the mind it's designed to protect us, you know what I mean? It's designed to look after us, so that's what it's trying to do. It is trying to actually keep us safe. It's in many ways, this isn't to be dismissive, of course not, or reductive in any way, but in many ways it's completely normal what the mind is doing. When anxiety in a lot of ways is normal, and I know that can sound like that's not to say we're wanting people to just accept it and get on with it. Of course, it's the exact opposite from a therapist's perspective, and you and I am sure we've had many conversations where our job essentially is the exact opposite of saying it, just get on with it and being dismissive. Of course not. But what we are saying is it's human to experience, for example, anxiety. It's human to feel, a bit rubbish sometimes. Therapy is not about finding, fixing the client to a point where they're never going to experience any bad or any difficult emotions again. That's you wouldn't be a human. We're not robots. Do you know what I mean?
It's about, for example, what you're saying there, I think, is if when a person comes to therapy with anxiety, say, we're not necessarily stopping the anxiety. We might hopefully be able to reduce the anxiety, but it's more about helping the client recognise anxiety maybe when it's getting bad, and also having the tools to be able to manage that anxiety, because like you said, we can't get rid of anxiety completely, and you wouldn't want to actually, because anxiety does play a part in keeping us safe. It's that part of the brain that produces anxiety is the part of the brain that acts very quickly. So and sort of an analogy that I use with people is, if I throw a tennis ball at your head, that same part of your brain where anxiety starts is the same part of the brain that wouldn't think. It'd just react, and it'd just catch that tennis ball and it'd stop you from it hitting you in the head. Where if you use the other side of your brain, the more logic part of your brain, that part of the brain would be thinking, okay, so there's a tennis ball flying at my head. If it hits me, it hurts. So do I need to catch it? Should I catch it with my right hand, or should I catch it with my left hand? By the time you've gone through that thought process, the tennis ball will hit you in the head.
Right, yeah.
Does that make sense?
Yeah, definitely.
Where, if I throw a tennis ball instinctively, you just hold your hands up and you catch it. You might miss and it might still hit you in the head, but generally that's what you do. And that's the same area of the brain where anxiety is produced. And so anxiety can sometimes be a good thing.
Yeah, the function of it, I agree. Yeah, it's it's good that the mind is fundamentally structured to protect us. That is not, it's like, again, I don't want to go off on a tangent, but the sympathetic nervous system is often the thing that is activated when we go into severe anxiety or panic. So your heart starts beating faster, you get blood to your muscles quicker, because you're going into defense mode. You couldn't survive without your sympathetic nervous system. But unfortunately, if it's activated unnecessarily, or it's become over adapted, so it's reacting all the time to situations as though it's perceiving threat, that's when it's problematic, or that's when it often becomes problematic, that we are in some ways overreacting, and that's when we need to hopefully, that's where CBT can be useful in learning techniques to relate. I think what you were talking about there really resonates with me, Brian. It's working with clients. I think CBT, when it's done well and ethically, and you get good results, shall we say, it's working, building that relationship up between the client and the therapist to a stage where you learn those techniques, and the techniques that work for you. It is very much an individual process as well. Someone can have CBT and feel that they had an experience where technique A and technique B were fantastic, and they could go and tell that to their friend, and their friend tries and goes, I thought that was useless, didn't help me at all. You know, it's very much it's very much on an it's like they say with if you've met somebody who really struggles with social anxiety, you've met one person who struggles with social anxiety, because of course we're all human beings, you know what I mean, so we all
and social anxiety just in itself is, I suppose, what you think, that's what you've just said there. It's different for every single person. How I would describe social anxiety for myself would be completely different how you would describe it. And again, with CBT, and CBT is massive, isn't it? You know, there's, you know, and again, like I've sort of keep saying, and I think probably the fact I keep saying it means that maybe we should do it, as in have an episode just on CBT, that we're now onto what's called the third wave of CBT, and there's lots of different offshoots of CBT because it is so big.
Yeah.
And again, that's what I like about it, because what works for one doesn't necessarily work for somebody else. And my explanation to CBT for people is it's about almost giving you a tool bag that you can carry around with you, and when a particular incident happens or when something happens, you can look into that tool bag and pick certain tools out rather than just having one thing that you use.
Definitely, yeah.
You know, and for example, we mentioned homework before, or tasks. Sometimes clients don't do it and don't want to do it and can't do it and don't find it useful. So it's not, you can only have CBT if you're willing to do homework. Don't get me wrong, you've got to be willing to do work, otherwise it won't work.
No, that's true. And I think there's the research is kind of conclusive that the greater your level of commitment to CBT, to the therapy, the greater the results are likely to be.
And I think what I mean with that as well, for example, like thoughts diaries, for example, are used quite commonly in CBT, where people record the thoughts throughout the week and things like that. But some people don't find that useful or helpful. So if they don't, that doesn't mean, oh, well, you can't, you know, good for CBT. What it means is, okay, well, let's look at something else. And then we might do, for example, grounding techniques, and that's something that you ask a client to go away and practice every day for a week. And it doesn't involve sitting there writing things down. But they might find that useful. So there's one tool that they can use, where thoughts diaries might not be a tool that works for them.
Yeah, definitely. I think a key thing with CBT, which is, again, I'm sure why it's so widely used and accessed rather and delivered, of course, is it's very, very adaptable as a modality, isn't it? As a therapeutic modality. Sports persons use CBT all the time, you know, work with CBT, I guess, from more of a coaching perspective or a goal-orientated perspective. People in workplaces, whether it's managers, workers, more kind of executive environments, CBT is worldwide, has been delivered in a very adapted way to suit whatever the goal is, whatever the client or the client group is looking to work towards. So I think CBT, one of the reasons why CBT is so widely prescribed, shall we say, and so widely encouraged, is because you can very much adapt it to the individual, to the person, and what's going on for them, or what, and also what area of the life that they're looking to get support in. Do you know what I mean?
Yeah, definitely. And I think the other thing with CBT, it's almost like, especially now, again, I just mentioned there about the third wave. It's almost with CBT, you can pick good things from other areas. I mean, you mentioned like coaching there. You know, in coaching, they use SMART goals. In CBT, we use SMART goals.
Yeah.
You know, mindfulness now is something that is a lot more introduced into CBT. Mindfulness on its own is a really good therapy, especially using sort of mindfulness-based stress reduction. Therapy is a really, really good way of helping people manage stress. But CBT, you know, the people who develop CBT and come up with new ways of working have realised that, so they take elements of let's take this element of mindfulness and out and put this into CBT. Okay, let's take this element of coaching out and put this in. I think even you know, like reframing is something that's used in CBT.
Definitely, yeah. It is.
But that originally was an NLP, neuro-linguistic programming technique.
That's right, yeah.
And they used, you know, they've taken that out of out of NLP and introduced it into CBT.
Yeah, cognitive reframing. That's
Cognitive reframing.
I forgot about that actually. Yeah,
I love it. I love.
No. I
reframing.
didn't forget about the technique. I just forgot about the fact that it was very much co-opted, wasn't it?
Yeah. It was.
Stole it.
They stole it, and even correct me if I'm wrong. I don't know if it's standalone therapy, but the rewind, is that in
The
part of
trauma treatments in CBT. Yeah, the rewind technique.
therapy. Well, that was again from NLP and hypnotherapy. That's a technique that's being used in as I say, hypnotherapy and NLP for a long time. But it's been adapted now for. I wasn't quite sure if it was a standalone or if it was part of CBT, because I do use rewinds, but when I'm using it within hypnotherapy.
Well, that's interesting that as well, because I think if I was what type of therapist would you class yourself as? If to answer that question, what label would you give yourself as a therapist?
So on my CV,
CV on the table, please.
I would class myself as an integrative therapist, which basically means I use a number of different therapies within my work. I would probably say I'm rooted and grounded within person-centred counselling. That's what I probably. That's my core training. That's my core. The bedrock of the therapy that I use. I use CBT. I've trained in CBT. I've trained in clinical hypnotherapy. I've trained in mindfulness. I've trained in solution-focused therapy. So I've done training in all of them sort of main therapies that I've just mentioned. I've done other training as well, specific to like trauma and things like that. But they're probably the ones I've just mentioned are the main ones that I use. And the reason why I like to be integrative is because, again, probably from my person-centred training, it's about what's best for the client. So if a client comes to see me and they're experiencing anxiety, for example, generally I would use more of a CBT approach, because the evidence suggests that CBT for anxiety works really well. An interest that I've got, a really big interest I have is with ADHD and working with people with ADHD. Again, the research suggests that CBT works really well with people with ADHD because it's goal orientated, it's quite directive, and it's very structured. People with ADHD find that those ways of working really helpful, and so a lot of the techniques. Although there's more research now that mindfulness actually works quite well with people with ADHD. So again, that's why I use mindfulness.
Can I just say as well, you said that you have an interest in ADHD, so I'm gonna, I'm gonna critique that a little bit, because for our listeners, it's more than an interest. You're a bit of a whiz kid with ADHD. I'm comfortable dropping that one, the exclusive there, that you are a very, very impressive source of knowledge when it comes to ADHD. So when you work with, when you're working in that, we should actually do an episode on ADHD,
Definitely, I definitely would like to do. And yeah,
we're going to have more episodes than Brookside here, we carry on.
And, I think, I have got good knowledge of ADHD because it's something I've been interested in for a long time for, lots of different reasons, some personal experience, what got me interested in ADHD. And then when I was learning CBT, I'd done a placement at the ADHD Foundation. And it's just something that I find really interesting and something that I've developed an interest and knowledge over the years. But if we were to do an episode on it, which I'd like to do, I think I'd probably like to get maybe a guest on who was even more
immersed in that world, sort of thing,
and had more knowledge than me.
Right. Okay. Yeah. That would be fantastic. Yeah. We'll definitely look into that, because I'd be really fascinated to learn from that conversation, without a doubt.
Mm-hmm.
So,
What about yourself? Sorry, because I'm just
I nearly got up to that end, didn't I?
How would you describe your way of working?
I would say similar to yourself, but with a slightly different kind of, I guess, slightly different background. But yeah, if I was to put a label on my my skills, if you like, my way of working as a therapist, it would very much be I'm an integrative therapist. So I've got qualifications in person-centered counselling. I've got qualifications in solution-focused, brief solution-focused therapy. I've got a degree in psychology, but CBT is what I've really kind of, trained in. That's my primary modality, shall we say. So yeah, CBT, I've got a master's in CBT. But again, I think one of the reasons why I asked you that before, Brian, is because I think it's interesting that this is obviously my opinion. I think any therapist, I won't say any therapist, but I think most therapists that are working in an ethical way, and to come back to that Carl Rogers, those core conditions of Carl Rogers, working in the best interests of the client and working very much from the perspective of the client and how they're experiencing things. Any therapist who's going to do a good job, you're very much working in an integrative way anyway. You're using the resources that you've got, or the skills and qualifications that you've attained to support the client sitting in front of you. Do you know what I mean? As opposed to the tunnel vision of no, if it doesn't fit into my very direct way of doing CBT, then there's nothing I can do for you. Do you know what I mean?
Yeah, I do. I think, again, I think people who train in one modality and that's the modality for them, and they immerse themselves in it and become experts in it, then going right the way back to what we said at the very beginning, if a client knows maybe they've had therapy before and it's worked really well, if they know that person-centered counselling is for them, and they go and see a purist person-centered counsellor, then that might work fine. I suppose, again, another analogy to use is, if you go to the gym to get a personal trainer, generally you'd go to the gym and get a personal trainer that knows a little bit about everything, a bit of strength training, a bit of cardio training, a little bit of other types of personal training, rather than going to a personal trainer that was specifically just trained in strength. So all you would do with them is just strength training, or all you would do with them is...
I like that, yeah, that's a good analogy.
Mobility training, for example. Ideally, you want to go to, I'd imagine, unless you're training for something specific, you would want to go to a personal trainer that knew a little bit of everything and was able to, do a little bit of strength training, do a bit of mobility training, do a little bit of cardio training, do a little bit of something else. You're probably going to get the most out of that, I think, I'd imagine. I
would guess so, yeah. And I think, again, it comes back to that sense of empowerment. It's like paradoxical empowerment, isn't it? You are empowering your client, whether it's in the gym, or obviously as a therapist in a therapy room. You're empowering your client as to what works for them, what's most suitable for them. As you're right, I completely agree as well. It is finding that, maintaining those boundaries. If you're offering CBT and then you just start delivering this completely different modality just because you happen to be trained in it or have read a book on it, that's unethical in many ways. So I think it's right that you need to be, again, come back to it, congruent and empathic with the client. If you're offering CBT, whether it's in your job or that's what you've advertised yourself as, that's what the client's expecting. So it's important to be very much working as a team, rather than you just saying, I'll throw in like kitchen sink therapy. I'll just do anything that I can think of and one of them will fit. It's like that can be unethical in many ways. So it's definitely about finding that balance. I do agree. Very much finding what can be useful, but also in the client's understanding of things and in the client's perspective. They are a key component of therapy, as we keep coming back to, is the client is experiencing what they're experiencing, not you're telling them what they're experiencing, you know.
Yeah, and that's why it's also really important at the very either first session or assessment session, depending on how you work, that you sit down with the client and go through what it is that the client wants, what's their expectations,
what's their reason for therapy, what's
Yeah.
their expectations, you know, as I said before, if it's CBT, what's the goal, what would be a good outcome from this. Yeah, absolutely. Just for the kind of final couple of minutes, we mentioned at the beginning of this episode about some of the myths and assumptions, and maybe stereotypes that have been attached to, or maybe, shall we say, have developed over the years around person-centred counselling and obviously and definitely CBT as well. Can we have a little bit of a myth-busting class for a couple of minutes?
Definitely, yeah.
What comes to mind for you when you think of CBT as maybe a stigma or?
Well, I think a myth again is CBT is the only therapy that exists, or CBT is the only therapy that really works. As well as it does work really, really well, it's not for everything and it's not for everybody.
Yeah, I think it can be over-adapted, can't it? It can be weaponised to be. You can do CBT for anything and it'll work. And I agree. Yeah, as I say, I'm a CBT therapist. I class myself as CBT as my key training, if you like. But definitely, I think it can be very. Unfortunately, it can be easily weaponised and it can be quite sold, oversold, and missold. Definitely, yeah, I agree.
I think with person-centred counselling, it's about you just sit there and talk. You just let you go and talk to the therapist, and that's it.
Yeah, it's directionless, and it's I think that's a huge myth with counselling. So I would even elaborate on that, Brian. I think counsellors don't say anything. They're like I think I heard it described once as like blank screen therapy. So you're just talking at your therapist, talking at your counsellor, and that's their job, is just to sit there and passively listen to you. And that's, as we've for all the reasons we've described, and all of the, you know, the points we've highlighted around Carl Rogers' theory, that's not true at all. You're not passively listening to somebody in therapy.
I think if you go to a person-centred counsellor session, and all the counsellor does throughout the whole session is go, then it's probably not the right
questionable, shall we say?
It's probably not the right counsellor for you.
Yeah.
I think I think within person-centred counselling as well, it is that you're just going to go there and talk, and that's all it's about, which there's a lot more to it than that.
Yeah, definitely. Again, I think I've described it before as like directionless. Just, there's no theme, and even if there's no concrete direction, you were describing this, talking about this before, Brian. That sense of, in counselling, sometimes people will turn up and say, on my way here, I was thinking, I don't know what I'm going to say tonight, but I definitely wanted to come. There's a starting point. Yeah. You're sitting in front of a therapist,
and there will be,
and you're doing it voluntarily. So
there's an element of direction, but it's just very, very, very gentle.
Yeah, I agree, and I think again, exploring your identity in relation to everyday life. Most people's, I would say, everyday life can feel a bit directionless, because there's no clear functionality. There's no trodden path. It's your identity, it's your life story. So that can feel a bit intimidating, a little bit abnormal. That, well, what's the A to B of this? And sometimes that can be, well, it's not always a clear, point A goes to point B. Sometimes it's a little bit of a, your own personal adventure, shall we say.
I think another thing that, in regards to sort of myths and misconceptions and things like that, I think for people to, if people want to access counselling and therapy, and they contact the therapist, and the therapist says to them, "Oh yeah, I can fix that, or I can make that better, or I can definitely 100% help you." I think it's just maybe being a bit wary of that as well, because
without it,
the therapist is not going to know whether they can help you or not until they've actually sat in a room with you and gone through. You know, I always say to you know, clients that contacted me, and they'll say, you know, can you help me with this? Or, you know, I'll say, well, you know, I can certainly try, and we can see where it goes, and you know, hopefully, yeah, I can, but I can never 100% guarantee that I can help that person, because I might not be the right counsellor for them.
Yeah, absolutely, and I think that's it's ethical, isn't it? You know, that's the way counsellors, hopefully, and all therapists should work. Yeah, that sense of can you help me, can you fix me, is another way of saying can you help me in a lot of respects. And I think that is something to be mindful of as well. It's a bit of a myth that therapists can read your mind. This is something with psychology. You know, I'd say I'm a psychology graduate, and particularly going into psychotherapy, this idea that therapists can read your mind. I would suggest that as a good rule of thumb, if any therapist comes across as though they're trying to read your mind, you probably got the wrong therapist.
Run.
Run.
No.
As fast as you can. But
I
think that can be the reason why I just want to mention that, because I think that can be for a person who's never had any kind of reference points or engagement with this world, you know, psychotherapy or psychology, that can maybe again be a little bit of a point of intimidation, that sense of you're going to start psychoanalyzing everything I say or every move I make or don't make. You're going to start wanting to root around into my childhood, I think, is another thing that can be a bit of a cartoon image of therapy. Maybe, you know, stretching back to the Freudian theory, you know, Sigmund Freud and psychodynamic approach. And again, I think that's very much a cartoon image of most modern day therapy sessions.
I mean, I think there's some relevance, isn't there, with depending on what it is that the client brings, that you may go to childhood and look at, you know, sometimes I do like a life timeline of, you know, from young right up to whatever age they are, but it's only if that's sort of quite relevant to something. But
I agree,
you know, not every client that comes you would say, oh, so tell me about your childhood, type of thing. That definitely is a bit of a myth, that every person that comes, we will start looking at childhood and get sort of transfixed on that. I do think there's a place for that, and that does happen sometimes if it's needed. But
it's not off the table. I completely agree. It's certainly not off the table, and it can be as you say, a central component of therapy. But I think the word you just used is spot on. It's this assumption that you are transfixed on your childhood is very much a cartoon myth of therapy sessions. Some other myths as well. Therapy is really expensive and it's lifelong. I've come across that one. Know people thinking that I wouldn't know, where to start. If I started with therapy, I'd love therapy. I've heard that's been shared with me from people a few times. I'd love to go to therapy, but I haven't got the money, I haven't got the time, and also if I start in therapy, I'm scared I'd never stop. And I think that is an understandable assumption, shall we say? It's an assumption, probably more than a myth, that, isn't it? And it's an understandable assumption, but I think it's largely disproven. For most people, don't spend their entire life in therapy, and it can be unethical actually as well.
Definitely.
To stay in therapy for too long. If it's it can be useful to, if you are looking to have therapy on a long-term basis, which in my experience as well, a lot of people don't have therapy long-term. They have a course of therapy which can go on for months or a year, 2 years, but they don't. It's not like most people are in therapy for years on end, without any.
I would probably say the clients that I see on average is between 8 and 12 sessions. So that could be between 8 and 12 weeks, or sometimes after 8 weeks we might move to 2 weekly sessions and things like that. Don't get me wrong, I have clients who've come for 20 odd sessions and longer, but on average, if I had to average it, it'd be between 8 and 12 for me.
Yeah, I agree, and I think the NHS guidance, I appreciate not everybody works in the NHS as a therapist, but I think as a rule of thumb, the NHS guidance is around that, and also the guidelines for working with like mood disorders, like anxiety disorders and depression, is similar to what you're saying. It's about 12 sessions, maybe, depending on what what the person was struggling with. If it was trauma, it might be more like 16 to 20 sessions. But even then, as you say, Brian, that's like 16 to 20 weeks, or maybe add another 5 or 10 weeks on top of that. It's certainly not seen as like years and years of therapy, you know.
I always think it's good, even if I do a block of sessions with people and they still feel like they need more, I always think it's good to have a break anyway.
Yeah, definitely.
You know, and then maybe come back and dip in and out. I think that can be something that people do. They dip in and out of therapy, and because they see it as an ongoing growth, which is fine. You know, I think that's okay. And again, with the expense side of things, you know, if you go to your GP, he can refer you to an NHS provider. There's lots of really good charities out there, whether it's to do with domestic abuse, bereavement, things like that, just general counselling where it's free. Okay, the downside is often the waiting lists are quite big, but even paying privately for therapy, there's lots of different price ranges within that. And again, I'd just say to people, just if you are looking to pay privately, just because maybe someone's charging a lot more than maybe the next person doesn't necessarily mean that they're more experienced or better. It might just be that the room they're renting is a lot more expensive.
Yeah, something as simple as that. I agree, yeah, and I think it comes back to, again, what we've discussed in this episode. It's what works for you. You're finding the right fit rather than, you know, the person who's the most qualified, shall we say, or even the most sells themselves the best. You know, nothing against. That's not a kind of subverted criticism of anyone at all. It's just I think therapy is definitely more accessible now, which is getting better. Definitely. It's still got a long way to go, mental health provisions, but it's definitely, I think, in previous generations, previous decades, it was very much a middle class thing. Therapy, you know, it was very much it was expensive, and it was seen as, you know, a more, as I say, I guess a more middle class, to put that label on it, provision. But nowadays, I honestly do believe that stigma's becoming loosened, and all the better for it as well. You know, that more people have got access. Therapy is not a sign of weakness as well. That's a big myth, and that's really one that sticks in my throat as well. That it's in any way, you know, shows that you're not tough enough to handle life, or you're not. I actually think it does the opposite. I think it shows the strength that you have. I really do believe that.
To recognise that there's stuff going on for you, and you go there to try and change it. Again, a bit like, use the analogy of going to see a personal trainer in the gym. Therapy should just be just as the same thinking as that. You know, go to the gym. Okay, I can go to the gym and do my own stuff, but actually if I go and see a PT who's more of an expert and trained in it, they'll get the best out of me. I'll get the best results. Going to see a therapist is exactly the same. You can go off and try and work on yourself by yourself, which great, but actually by going to see a therapist, they'll get the best out of you.
I couldn't agree more. It's a great analogy as well. I mean, it sounds absolutely ludicrous, doesn't it, to say, you go in the gym, well, you know, what sort of person are you? Why do you need the gym to get yourself, physically?
Why do you need a PT? Like, are you too weak to go by yourself?
Exactly. Or if you went to the hospital for an operation on your physical self, let's say, or treatment on your physical self, whether it was physio or, as I say, an operation, you wouldn't dream of saying you're weak because you're doing that. And because you had physio, or because you had, you know, your broken leg was reset or something. You know what I mean? You'd never say that you were weak for that. And yeah, I think it's certainly getting better, but I do believe there's a long way to go. So
it's definitely getting better.
They loosen that stigma, because that's a big myth as well, that it's a sign of weakness to explore yourself and engage in therapy. That's just not true at all.
And one more myth, I think, be a good one to end on.
Yeah, go on.
That unless you're doing maybe hypnotherapy, but generally if you go to therapy, it's a myth that you'll be lying on a chaise longue.
See, I was disappointed by that as well, because I always wanted to lie on a chaise longue. I never had one.
I mean, I have a couch in my therapy room. If people want to lie down, they can, but it's not expected, and not many people do. Well,
you're lying on it now.
Nobody's. I know, yeah. Nobody does. So yeah, just in case people think they've got to go and lie down and start talking about the childhood and stuff like that.
That's a great point, and I think again that definitely harks back to the cartoon image from the Freudian, caricature of therapy. That, as you say, come in, you lie down on a chaise lounge, and this boffin in a white coat wants to hear all about your childhood and will tell you what's, why you're a broken person. That's a complete and utter load of hogwash. And and luckily, as I say again, all these myths, I do feel like there's still a bit of a way to go, but all of them are becoming more like known as myths rather than
and I think
misunderstandings.
And I think like you said before, now there are a lot more people who are coming to therapy. Like I get loads of like young lads and stuff coming to therapy. They obviously go away, and hopefully, I know some of them do because they tell me they do go away and talk to their mates. And again, all of those stigmas are getting broken down because just your normal average person like ourselves are starting to access therapy now because it is more accessible and it's more understood, and they're then going back out into the world and spreading that round that actually you don't do all of those things that we've just said. So I'm just aware that we're coming to the end, and before we finish, I just like to know what our next episode's going to be.
Our next episode, you know what? I could sit here all day. I enjoyed that conversation, Brian.
Me too.
So our next episode is going to be, well, it's titled, Why Do I Have Anxiety? Answers on a postcard.
Right, okay.
Why do I have anxiety? So we're going to have a good chat about anxiety, what it is, what it isn't.
Mm-hmm.
And I think we're going to explore that what anxiety can lead to when it's not treated, and what it's not when it goes unacknowledged, shall we say.
Mm-hmm.
And also as well, I think it'd be good for us to share some techniques that we do use in sessions and that we've obviously learned through our training and through our jobs. That sense of what can you do to actually maybe regulate yourself a bit more. And as we were saying when we were talking about TBT earlier on today, that sense of relating to your anxiety.
Yeah.
So sharing some techniques as well, I think hopefully will be quite helpful.
Definitely. Yeah, sounds good. I think I think spending a whole episode on anxiety is a good episode to do, and we'll explore the different types of anxiety: social anxiety, health anxiety, generalized anxiety. I think we'll go into a bit of depth on all the different anxieties and how we would work with them within the therapy room, I think. Yeah.
Sold. Sounds good to me.
So I'd say that's a wrap for this week.
See you next time.
See you next week.
Thank you.